Thanks, Dominic, and let me just echo the thanks that have gone before me to the Planning Committee and to the staff in particular who really did the hardest of the work in putting this great workshop together. We're going to spend the next day and a half really diving in with some of the experts in the field that are best known and innovative. We'd like for this to be very, very interactive. So what we're going to do is focus on, as you've heard, this idea of patient and family and even citizen engagement in the three areas that Michael outlined. So essentially shared decision making, knowledge creation, knowledge generation for research so that we can improve population health, and then changing our expectations for value in healthcare and how we can engage patients and families in doing that. That begs the question, at least for me, what is patient and family engagement? So for most people that we work with, it's kind of like a Rorschach test, or even better, the Supreme Court's definition of pornography. Like, you can't define it, but you know it when you see it. I think we can do better. And in fact, the Health Affairs article that you guys have in your packet, you have some of the cover from the Health Affairs article, begins to really dive into a little bit more multifaceted definition of engagement than I think that which has traditionally been thought of for most people, which is really around engagement in care. For some people that can be behavior change, et cetera. But what the Health Affairs article lays out is a framework, and it talks about engaging patients and families at three levels, really. One is, of course, in their own care, right? We know a fair amount about that, and we're going to continue to talk about that and find even more effective ways to do that. The second is engagement in organizational or institutional design and governance, right? So this could be, for example, something like if an institution is implementing shared decision making, how they might collaborate with a group of patients and families who are most likely to be the target audience for shared decision making, if you will, and figure out how the institution can build decision aids into the workflow, not just of their clinicians, but also of their patients and families, so that the patients and families themselves are really part of designing the process. We've seen this to great impact with a number of initiatives, whether it's patient-centered medical home or individual hospitals embedding patients and families on safety committees, et cetera. And then the third level is it's policy making. So engaging patients and families and their representatives in policy making. And that might be at the national, state, or the local level. We have some great examples of that today in the health information technology arena on the policy committee, or of patients and families on other esteemed policy making bodies alongside clinicians and employers and health plans and researchers. PCORI, I think, is another good example of that as well. So really, our goal is that together with our terrific speakers, with the audience, with the planning committee panel, that we can use this day and a half together to start to outline a concrete and actionable pathway towards how we might really accelerate progress in patient and family engagement in those three areas that we've outlined. The output of the day and a half will be a report or a summary of what is said and what takes place and what everybody's thoughts are. So that means that audience participation and interaction is really critical. We want to make sure, the planning committee was very clear on this, we want to make sure that the audience has a chance to get up and not just ask questions, but also give your viewpoints and your comments, and that's the way that it will make it into the report. We also have hundreds joining us online, and there is a way for you online to send in your questions, so we really encourage that. And then for those in the room, we have microphones here, and then also for those anyone in the overflow room, they'll be coming in as well during the Q&A part to use these microphones here. So let me do a couple quick housekeeping things, and then we're going to get right into our first speaker. So we are going to break for 15 minutes at 3 o'clock today, thereabouts, I hope. And we will adjourn at 5. We're going to come back bright and early at 8 o'clock in the morning, which is very exciting because it's all going to be energetic patient and family engagement, right? Okay. We talked about the webcast being live, so make sure that you're using the microphones when you are either asking questions. Our presenters are going to be speaking from up here. For you speakers in the audience, there is a limit on the number of microphones that can be on at the same time, probably so we don't interrupt each other. Clearly these people have worked with me before. So when you're done talking, turn your mic off. And then I think Michael mentioned the slides presented today will be online afterwards, but there's also a really terrific briefing book that has a lot of in-depth materials. I think you guys all got a link to that beforehand, so make sure that you take a look if you haven't already at that briefing book. So right now we're going to start in exactly the right place, in my humble opinion, and that is with a voice for patients and family caregivers, and that is Dr. Jonathan Welch. He has experiences as a family member, but also as a physician, and he brings a very unique perspective to this discussion that we thought as a planning committee that it was essential to lead off with. He's an instructor in medicine at Harvard Medical School and a practicing emergency physician at Brigham and Women's Hospital in Boston, and his work focuses on patient and family-centered care. He also serves on his department's Patient and Family Advisory Council. Some of you may have seen his writing. It has been featured in Health Affairs, Roll Call, The Washington Post, and also the Chicago Tribune. So please join me in welcoming Dr. Welch.